Topiramate has been around for a long time. It has a proven track record. It was one of the best studied oral preventives ever until most recently. And so we have a lot of data that back its use. It is really a very helpful and very effective medication for many, many people. And it is, at least in the United States, the most commonly prescribed oral preventive medication at this point. So yes, it is a good option for many people. And just like any other preventive medication, we really want to take the whole patient into account and look at their other medical conditions, their allergies, whether or not they have kidney stones, whether they maybe want to lose a little weight in the case of topiramate, or if there's other issues that could potentially be addressed by the medication. But overall, I use a lot of topiramate in my practice, and I find it very helpful for many people. The frequency of dosing, I think, is really important because when patients have to take medications more than once a day, it becomes burdensome. They forget to do it. They have their own lives to live. And so once daily dosing for an oral preventive is really a benefit. And the first medication that went to once daily dosing was valproate, but now there are several medications that we use for headache prevention. And many patients find that it's almost a relief. It's so much easier to take medicines once a day. And obviously, if they're taking their medicine every day like they're supposed to, it's more likely to work for them. This is an interesting question because there are very few studies that ever looked at combination therapy in a clinical trial. That said, we use combination therapy all the time. And it really helps in many cases if the first preventive gives some benefit but not enough benefit, to use another preventive medication or another preventive treatment that has a different mechanism of action. So for example, right now we might use onabotulinum toxin with an oral preventive, like topiramate or maybe another oral preventive, or one of the anti-CGRP monoclonal antibodies with a medication that has a different mechanism of action, which could be an oral preventive, it could be a device, or it could even be onabotulinum toxin. And for many people, adding on that additional therapy really gives them much better migraine control.